Wait, what do you mean that stress could be one of the reasons that baby's breech? So, on this One Belly Wednesday, what I want to go into is how stress impacts the brain, how the brain impacts the muscles, and how the muscles impact how a baby is sitting in the pelvis. I'm Doc Edwards, and we talk on One Belly, Two Brains about the ideas that we have during pregnancy and during baby's first year of life on how to optimize function, on how to get the body as balanced as possible during pregnancy so we can have better, more comfortable births when we have babies so they can grow and maximize their development, and all the ways, the little things that we can look for as parents so that we can gain the confidence and the courage to be able to make really good decisions for our families when it comes to their healthcare. So, one of the things that comes into my office a lot are babies who aren't in a good position for birth. That includes things like babies who are sideways, or babies who are sunny side up, or babies who are head up, what we call breech fetal position. Now, as a chiropractor who's been trained in Webster technique and actually teaches other chiropractors advanced techniques to help out with balancing the pelvis, you would think like I'm super good at spinning babies, right? Like flipping babies around. It's not what I do at all. What I do is I go through a very scientific process to figure out the reasons why the pelvis itself isn't being balanced. Because listen, babies will go head down if they have room to. They want to. They're big old bobbleheads are the heaviest part of their body, and it wants to be nestled down in the pelvis. So if it's not, there's usually a reason why. In previous videos, I've talked a lot about some of those reasons. Sometimes we're too loosey-goosey in the back part of the sacroiliac joint. And so the muscles of the pelvis can get really tight. And so it works like a trampoline and baby just keeps on bouncing out of there. Sometimes you can have that subluxation, that misalignment in the pelvis that those chiropractors who really specialize in doing this work are super masters at figuring out. But there is one other level that I always check because it's really important, and a lot of doctors miss this. When we talk about stress, stress right now is probably one of the biggest issues that we're seeing in pregnancies. We're looking at things from whether we talk about the pandemic, or we talk about work, or we talk about who's going to be in my birth, all those kinds of things are stress factors. And so it tends to really work hard on the brain, like really hammers those neurons so that they don't work super good. Specifically, the neurons that are affected live here in the front part of your brain. We call that the prefrontal cortex. Those muscles are really responsible that listen to that prefrontal cortex. We're doing an action we call flexion. So when I mean the flexors, if you look at me right now, if I tip my head to the side, I'm using a muscle here to flex, to shorten that angle between my head and my neck. If I flex my bicep like that, right? I'm shortening the angle between my forearm and my bicep. The other thing, though, that we have that's unique among two-legged mammals is when we're embryos, we do this foregut rotation. Ooh, what's a foregut rotation? So foregut rotation sounds like something you need to go to a doctor to fix, right? It's actually a natural thing that happens in those of us who stand on two legs, where our flexors are no longer just on one side of our body, they flip around to the other side. So when we're looking at flexors on the lower half of your body, they include the things that make your calf come up to your butt. That when you curl your toes, you're technically flexing those muscles. Okay, it doesn't just mean making a muscle bigger, it means the actual like contraction. So some of the ones that are super important for pregnancy are a muscle called the piriformis muscle. That's a muscle that's in your butt and it can turn your toe out. It is connected with connective tissue all the way into your cervix. So if that's tight for some reason, that's not good. That pulls the cervix out of alignment and baby can't quite get engaged in there. The other one that's really, really big in breech is called the psoas muscle. The psoas muscle is one of the longest muscles in the body. It runs from the body of the lumbar vertebrae past the uterus through the inside of the hip wall and then all the way down. Sometimes there's connections all the way down to the thigh and into the knee. Now, that muscle itself can work like a wall for a baby. And if that wall is super tight, then babies can't turn around. Now, a lot of us have been trained to look for that muscle and we'll massage it or we'll stretch it. There's a lot of things we do for that muscle to address the muscle problem. But that muscle is a flexor. And if the brain isn't telling that flexor to relax, then what's going to happen is you're going to stretch it all day. You can rub it, you can massage it, you can exercise it. But if the brain communication to that muscle isn't good, it's just going to tighten right back up again. And so that's why for some moms, they find that the baby was breached and then goes head down, and then it goes back head up, and then it goes head down, and then it goes head up, and there are these flip floppers, right? So if you're dealing with a flip flopper, that might be part of the reason. Is that it's not more body work necessarily that we need to do. The biggest adjustment that we need to do is in between the ears. So we need to get that mom some kind of stress relief. She needs to maybe get a journal so she can write out some of these thoughts so she's not holding on to them. Maybe there's some stuff that her partner can do to relieve some of the stress, take over some of the jobs and responsibilities. Like how many moms right now are sitting at home? They didn't expect to have to be school teacher and cook and cleaner and maid and all the things at home. They just wanted to do the one thing, and now suddenly they got to do all the extra jobs, right? We saw so many women leave the workforce over the last year. It like turned my stomach because there were so many moms that were like fulfilling the thing that they always wanted to do. And now suddenly they're relegated to, nope, you've got to do all these other things here at home. And it's super stressful. It's like having 4 jobs at once. So there's a lot of things that we can do to relieve stress. I have a app that I love, love, love. There's actually 2 of them depending on the store that you have on your phone, iTunes or the Google Play Store. You can find them called Binaural Beats or Brainwave 32. They're apps that we send links to for our patients because there's this really cool biohack that you can do to put one earbud in and it makes one frequency and the other earbud in and it makes a slightly different frequency and your brain waves make up the difference. And those brain waves, they've scientifically proven are related to things like relaxation, sleep, meditation, stress reduction. It's a real simple, easy little biohack that sounds like a little hum in the background of your earbuds so you can listen to whatever you want to, like last week's One Belly Wednesday on who you should choose when you're looking for a pregnancy chiropractor. So I always love giving these little tips, little pieces of advice to you guys. We're here every single week. If you have somebody who has a baby who's not in a great position, send them this video. We have in the last video, we talked about the ICPA and how you can find a chiropractor. There's lots of chiropractors who are happy to help. If you're local here to Southwest Florida, we've got 3 locations around here to serve you. And so we're always happy to serve however we can. I'm Doc Edwards, and I look forward to seeing you guys next week. Until then, I hope you all take great care.